Dr. Nicole Saphier is a Fox News medical contributor, and Calley Means is the co-founder of TrueMed and a big food whistleblower. Great to have you both. I'm going to start with you, Nicole. So I've always known the benefits of breastfeeding for my babies, but it wasn't until I became friends with you that I understood or learned about the benefits for me when it comes to breast cancer.
Well, that's right, Rachel. And just like you, I breastfed all three of my children. But the science when it comes to breastfeeding is absolutely clear. It's evidence-based. It is very good for the baby. You touched on some of it. It decreases the risk of childhood infections, sudden infant death syndrome, obesity, diabetes, and other diseases as they get older. But it also has wonderful health benefits for the mother. Lowers the risk of breast cancer, ovarian cancer, cardiovascular disease. And actually, the longer a mother breastfeeds, the lower their risk of postpartum depression. So it's good physically and mentally, and it also increases the bonding between a mother and a child. Now, we have to remember, Rachel, not everyone is actually able to breastfeed. So when we are criticizing this big formula industry, we have to make sure that people understand that doesn't mean that we're criticizing people who are choosing not to breastfeed. In fact, I don't think it's their fault for the most part. I think there are a lot of confounding factors. I think that you have a big food industry who are taking advantage of vulnerable, insecure new moms. We all feel that insecurity early on. You also have the hospital that are trying to check their boxes, making sure that the baby is gaining weight before the baby leaves. But at the end of the day, we need to be funneling a lot more attention and support to these new moms because breast is certainly best for those that are able to breastfeed.
Well, it's not easy to breastfeed at first, and it takes time and it takes support, and you just throw them formula or push them into thinking, of course, people are going to take an easier route. Calley, talk about the influence of big food on this.
Yeah, let's just take a step back. I'm just going to state the obvious, but a mother producing consciousness in her body and miraculously creating the sustenance that new life needs, it's the most miraculous act a human performs. We will never understand the complexity of this act. And it is inconscionable but very strategic that we try to get kids immediately onto a processed food conveyor belt by obfuscating whether, and let me just read the ingredients of a leading formula, corn syrup, sunflower oil, and soybean oil, obfuscating whether these highly processed ingredients are akin or better, potentially, than what the mother produces. It's really the start of the treadmill. Now we have Michelle Obama telling 4-year-olds that sugar water is healthy. We have the NIH telling 10-year-olds that Lucky Charms are healthier than beef. We would expect the American Academy of Pediatrics, of any organization, to be standing up and saying, let's get back to basics here. Let's follow the science and have awe for the miraculousness of natural processes. But no, if you actually go today to the American Academy of Pediatrics website, go to the top of their donor list, the top donor is Abbott, the #1 maker of formula. So this is unfortunately completely bought off, and we're obfuscating the fact that we just have to get back to basics. And as the point was made, support mothers whatever they choose to do. We need to have awe and support mothers.
Yeah, support breastfeeding mothers, support all mothers. But also we need to look at the Breast Cancer Awareness Month. Maybe they should do a better job of explaining that it has that kind of preventative benefits for moms as well. Both of you, thanks for talking about this. It's one of my favorite topics. So thanks for joining us.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.